Stop for 2 seconds and look at your big toe. I know it sounds strange, but it can save your life. 5 specific signs on the big toe can appear months, sometimes years, before a heart attack or serious heart failure. And most people don't know this. They look at the foot, see a different color, swelling that won't go away, a nail that changed shape, and think it's normal at this age. It's not. In many patients who had a serious cardiac event, the first warning appeared on the feet. Not in the chest, on the feet, and it was ignored. Cardiologists have known this for decades, but the information rarely reaches the patient at home. Today, I'm going to show you 5 signs that deserve attention. Each one has a real medical mechanism. Each one has a simple test you can do at home right now. And each one, if present, is a reason to schedule a consultation. Not to panic, to act calmly. If you're past 60, this video can change your life. Subscribe to the channel, turn on the bell, and tell me in the comments where you're watching from. Before I show you the 5 signs, I need to make 2 extremely important warnings. First warning, this video does not replace medical consultation. The signs I'm going to show are alerts for you to seek cardiological and vascular evaluation, not for self-diagnosis or self-medication. Found a sign? Schedule a consultation. Have doubts? Schedule a consultation. Are you taking medication for the heart, blood pressure, cholesterol, diabetes? Never ever stop on your own. These medications save lives. An interruption can cause heart attack, stroke, decompensated heart failure. Always talk to your cardiologist before any change. Second warning, even more urgent. If you're feeling right now strong chest pain, pain radiating to the left arm, jaw or back, sudden shortness of breath, cold sweat, nausea, intense pallor, or severe dizziness, this could be an ongoing heart attack. Don't wait it out. Don't take medicine. Don't drive yourself. Call 911 now or ask someone to call. Time of care in a heart attack is heart muscle saved. Don't lose a minute. Now let's go to the 5 signs. The first sign is a change in coloration on the big toe, especially when the big toe turns purple, bluish, or whitish, and this pattern persists even in a warm environment. This is called peripheral cyanosis. What's happening behind this? When the heart can't pump blood with enough force, or when arteries are clogged with fatty plaques, oxygenated blood doesn't reach the extremities properly. And the part farthest from the heart, the big toe of the foot, is the first to suffer. Cardiologists call this a sign of low peripheral perfusion. It can be caused by advanced heart failure, severe peripheral artery disease, or embolism. How do you test at home? Compare both big toes. Are they the same color? If one is more purple than the other, it's an important sign. Compare also with the rest of the foot skin. Is the big toe darker than the rest? That pattern needs evaluation. Another tip, press the pad of the big toe for 3 seconds, then release. Count how many seconds it takes for the pink color to return. More than 2 seconds is slow capillary refill time, a sign of poor perfusion. What to do? Schedule a consultation with a cardiologist or vascular specialist. Initial exams include echocardiogram, electrocardiogram, and ankle brachial index, which is a simple painless exam done with a blood pressure cuff that accurately detects peripheral artery disease. Peripheral artery disease, when present, doubles or triples the risk of heart attack and stroke. Diagnosing it early completely changes the prognosis. The second sign is the big toe and foot persistently cold, even when the rest of the body is warm, accompanied by pallor. Here the mechanism is very similar to the first sign, but with a different characteristic. Chronic cold in the extremities is a classic sign of peripheral artery disease. The arteries of the lower limbs get clogged with atherosclerosis plaques. Attention to this point. Atherosclerosis is not just a leg disease. It's a systemic disease. If there are plaques in the foot artery, there are very likely also plaques in the heart artery, brain, carotid. The cold big toe is, in practice, a window into what's happening in the most important arteries of the body. How to test at home. Compare the temperature of both feet by placing your hands on the big toe and the top of the foot during the day in a normal environment. Cold and white feet, especially after exercise, are an alert. Another test is the capillary refill time, which I explained before. Another important observation: if you feel pain or cramping in the calf when walking, and that pain improves when you stop, this is called intermittent claudication, and it's a strong sign of peripheral artery disease. What to do? Same as the previous sign: cardiologist, vascular specialist, ankle brachial index, arterial Doppler ultrasound of the legs. If confirmed, treatment includes rigorous control of pressure, cholesterol, diabetes, quitting smoking absolutely, walking regularly under guidance, and specific medications as medically indicated. The third sign is persistent swelling of the big toe, top of the foot, and ankle, especially when bilateral, meaning in both feet at the same time. This type of swelling can be the first visible sign of heart failure. The mechanism is as follows. When the heart can't pump blood with the necessary force, especially the right side of the heart, blood accumulates in the venous circulation. This congestion causes fluid to leak from vessels into tissues. And by gravity, this fluid accumulates first in the legs, ankles, feet, and big toe. Typical features of cardiac edema: worsens during the day, improves in the morning upon waking, leaves a pressure mark when you press the skin with your finger, known as pitting edema or Godet sign. Caution: not all bilateral swelling is cardiac. It can be of renal, hepatic, chronic venous origin, or side effect of medications like certain antihypertensives. That's why self-diagnosis doesn't work. Medical investigation is fundamental. How to test at home. Press with your finger on the top of the foot for 5 seconds. Release. Observe if there's a sunken mark. Compare also the ankle. Is the joint blurred by the swelling? Are your shoes tighter than before? Rings and footwear are good indicators. What to do? Consultation with a cardiologist, echocardiogram, BNP blood dosing, electrocardiogram, and complementary exams as needed. Heart failure diagnosed early and treated correctly allows a long and active life. Ignored, it's progressive and fatal. The fourth sign is digital clubbing, also called Hippocratic fingers. It's an alteration in the shape of the nails and fingertips, including the big toe. The nail becomes more curved, more rounded, like an inverted watch glass. The tip of the finger becomes wider and more bulbous. The medical mechanism involves chronic hypoxia, that is, lack of adequate oxygenation in tissues for a long period. This can happen in chronic lung diseases, which are the most common causes, but also in cardiac diseases such as infective endocarditis, cyanotic congenital heart disease in adults, and some rare conditions. Attention: clubbing usually develops over months or years. If you always had nails like that, it's probably not an alteration. But if there was a gradual change, it's an important sign. How to test at home. Shamroth test. Bring the nails of both big toes together by the tips, with fingers extended and pointing up. Look from the side. In a person without clubbing, a small window or rhombus forms between the two nails. When there's clubbing, this window disappears and the nails stay glued. Simple, free test you can do now. What to do? Broad investigation with cardiologist, pulmonologist, and general practitioner. Echocardiogram to rule out valve problems and endocarditis, and pulmonary evaluation with tomography if necessary. The fifth sign is hair loss on the top of the big toe and foot, associated with weak or absent pulse. This sign is especially relevant for men, although it also occurs in women. Hair needs good blood circulation to grow and maintain itself. When the foot artery is clogged with atherosclerosis plaques, circulation is insufficient, and the hairs of the region fall, and the skin becomes smoother, shinier, thinner, and drier. Along with this, the arterial pulse becomes weak or absent. This is a classic sign of advanced peripheral artery disease and requires urgent evaluation. How to test at home. Look at the top of your big toes and the top of the foot on both feet. Compared to photos from years ago, or compared to the legs and arms, has hair decreased a lot? Is the skin smoother, shinier, atrophied? That pattern deserves attention. For the pulse, palpate the foot between the big toe and the second toe, on the top of the foot. more or less in the middle of the dorsum. That's the dorsalis pedis pulse. You should feel a soft pulsation. Try also behind the inner malleolus, behind the ankle, where the posterior tibial pulse is. If you can't feel either on one side, or if you feel it very weak compared to the other side, it's an important alert. What to do? Same as previous signs: cardiologist, vascular specialist, ankle brachial index, arterial Doppler, and complete cardiovascular investigation. If you found any of these 5 signs at home, I ask you one thing: take a deep breath. Don't panic. Finding a sign doesn't mean you're having a heart attack now. It means it's worth scheduling a consultation. And that consultation can be literally what changes your story. God bless you and give you much health. Until next time. Share this video with someone you love, especially if that person has already passed 60, is hypertensive, diabetic, a smoker, or has a family history of heart attack. The right information to the right person saves lives. And tell me in the comments, did you find any of these signs when looking at your foot now? Which one was it? Now let me talk about the risk factors that increase the chance of having these signs and developing heart problems. There are 8 main ones: arterial hypertension, poorly controlled diabetes, high cholesterol, especially elevated LDL, active or recent smoking, abdominal obesity, sedentary lifestyle, family history of early heart attack in parents or siblings, and untreated chronic stress. The more factors you have, the greater the risk. The good news is that 7 of those 8 factors are modifiable. You just don't change family history. Everything else responds to treatment and habit change. And that change, when done seriously and with medical follow-up, drastically reduces the risk of serious cardiovascular events. Frequently asked questions: how long does one of these signs appear before a heart attack? There's no rule. In some cases, the signs appear months before. In others, years. In others, simultaneously. The important thing is not to wait for the acute event to seek help. I take medication for pressure and cholesterol for years. Do I still need to worry? Yes, absolutely. Being on treatment reduces the risk, but doesn't eliminate it. Keep taking, keep going to consultations, do annual exams, and observe your body. Can I do ABI in the doctor's office? Yes, in many medical offices, this exam already exists, or it's requested by the general physician and done in reference centers. Ask your doctor. Medicare covers it. I'm diabetic. What's my situation? Diabetics have higher cardiovascular risk and higher risk of peripheral artery disease. That's why examining the feet daily is already a basic recommendation for diabetes care. If you're diabetic and don't have this routine yet, start today and do glycated hemoglobin every 3 to 6 months, annual eye exam and foot examination. I had chest pain once. It passed on its own. Should I worry? Yes. Chest pain that passes on its own can be angina, which is the warning of a heart attack. Seek a cardiologist for investigation. Stress electrocardiogram or myocardial scintigraphy can identify ischemia. Practical action plan in 7 steps. First step: tonight, when you lie down, examine your feet calmly. Observe coloration, temperature, swelling, hair presence, nail shape, pulse. Write down what you saw. Second step: if you found any alteration, or if you've already passed 60 without a recent cardiological consultation, schedule a consultation with a general practitioner or cardiologist this week. Third step: go to the consultation with a list of medications, previous exams, and family health history. Fourth step: do the basic exams the doctor requests. Blood count, blood glucose, glycated hemoglobin, total cholesterol and fractions, triglycerides, kidney function, liver function, electrocardiogram. As needed, echocardiogram, ABI, Doppler, stress test. Fifth step: if you smoke, start the process of quitting now. Seek help. Medicare covers smoking cessation counseling. Sixth step: start walking daily, at least 30 minutes, at the pace you can. Walking is the most studied exercise for cardiovascular health. Seventh step: adjust nutrition. Reduce ultra-processed foods, sodas, processed meats, fried foods. Increase vegetables, fruits, fish, legumes, olive oil. The Mediterranean diet is the most studied for the heart. Let's debunk important myths. Myth 1. A heart attack always gives strong chest pain. False. In women, the elderly, and diabetics, a heart attack can appear with atypical symptoms, such as extreme tiredness, shortness of breath, back pain, jaw pain, or just feeling unwell. So attention to the body is fundamental. Myth 2. If blood pressure is controlled, I don't need to worry. Partially true. Controlled pressure reduces the risk, but doesn't eliminate it. Other risk factors need to be monitored. Myth 3. Biking replaces walking. Each exercise has its benefit. Biking is great for joints and cardio. Walking has additional benefit on bone density, balance, and leg perfusion. Combine them. Myth 4. Teas and herbs replace heart medicine. False and dangerous. No tea or supplement replaces antihypertensives, statins, anticoagulants, or other cardiac medications. Use them as a complement, never as a substitute, and always inform the doctor. Myth 5. If I don't have family history, I won't have a heart attack. False. Family history is one risk factor among several. People without history can have cardiac events if they accumulate other factors. God bless you and give you much health. Until next time. An important reflection. The body is intelligent. It always warns beforehand. The problem is that we learn to ignore the small warnings, thinking they will pass, or that they're age-related, or that they're not important, and the body keeps accepting, until one day the small warning becomes a serious event. Those who live with attention to the body generally age better. It's not hypochondria, it's listening to what the foot is saying, what the breathing is saying, what the tiredness is saying, what the sleep is saying. That's not exaggeration, that's care. Let's talk a little about the heart of women after 60. After menopause, female cardiovascular risk increases a lot because estrogen, which has a protective effect on arteries, drops. Many women think heart attack is a man's thing. It's not anymore. In some regions of the world, more women die of cardiovascular disease than breast cancer. And heart attack in women tends to have more atypical symptoms: extreme tiredness, shortness of breath without clear reason, malaise, pain between the shoulder blades, nausea. So women after 60 also need regular cardiovascular checkups, even without obvious symptoms. Talking now about men's hearts. The typical male heart attack tends to have more classic symptoms, but can also be silent, especially in diabetics. Another important point for men: erectile dysfunction can be an early sign of cardiovascular disease. The penile artery is thinner than the heart artery, so it suffers first with atherosclerosis. Men with erectile dysfunction without an obvious cause should have a complete cardiovascular evaluation. About nutrition for the heart, in summary: increase vegetables, fruits, fatty fish like sardines and salmon, extra virgin olive oil, legumes, nuts. Reduce ultra-processed foods, sodas, processed meats, fried foods, added sugar in excess, salt in excess. It doesn't have to be radical overnight. Gradual and sustained changes are more effective. And remember, nutrition helps a lot, but doesn't replace medication when the cardiologist prescribes. About exercise, in summary: walk at least 150 minutes per week, distributed in 5 days of 30 minutes each, or as the doctor recommends. Include 2 to 3 days a week of light strength exercise, with weights, bands, or body weight, and take care of balance with Tai Chi, adapted yoga, or specific exercises with a physical therapist. All this added drastically reduces cardiovascular risk. About sleep, in summary: sleeping poorly, sleeping little, or having untreated sleep apnea are real cardiovascular risk factors. If you snore loudly, have breathing pauses during sleep, wake up tired, or sleep less than 6 hours per night, talk to your doctor. Polysomnography can detect apnea, and CPAP treatment significantly reduces cardiovascular risk. About stress and mental health, in summary: untreated chronic stress, anxiety, depression are cardiovascular risk factors often forgotten. Taking care of mental health is part of taking care of the heart. Therapy, meditation, social connection, hobbies that bring joy, spirituality are important paths. Don't be ashamed to seek help. Taking care of the mind is also taking care of the heart. An honest, practical summary. 5 signs on the big toe can indicate cardiac or vascular problems: purple coloration, cold and pale foot, persistent swelling, clubbing, hair loss with weak pulse. Each has a real medical mechanism and a simple test at home. Finding a sign is not a diagnosis, it's an alert to seek medical evaluation. Cardiologist and vascular specialist are the indicated professionals. Basic exams: ABI, echocardiogram, Doppler, electrocardiogram, blood tests. Treatment involves rigorous control of pressure, cholesterol, diabetes, quitting smoking, regular exercise, healthy nutrition, and medications as indicated. Never stop cardiac medication on your own. And on suspicion of acute heart attack, call 911 immediately. God bless you and give you much health. Until next time. If this video helped you, share it with someone you love. It can be the information that changes the life of a dear person. Take care of yourself with wisdom, with attention to the body, with true information, and with much self-love. You deserve a strong heart, days with energy, and a long life. God bless you. Until next time. Amen. Share with those you love, especially with people who have also passed 60. God bless you. Until next time. Amen. Health and blessings. Take care always. Keep faith and daily care. God bless you. Until next time. Amen. Health, peace and faith. Amen. Take care with love. Your life matters. Your heart matters. Your family matters. God bless you. Until next time. Amen. Blessings to your family. Amen. Good night. Take care. Amen. Peace and blessings. Amen. Health, peace, faith, and love. Amen. A final reflection on heart care and the journey of aging. The heart beats over 100,000 times a day, every day, without rest, your entire life. It deserves your attention, your care, your investment. Every healthy choice protects it. Every walk, every consultation, every medication taken correctly, every food choice. You are not a passenger in your heart's health. You are the pilot. Drive with care. A practical reminder. Cardiological consultation is recommended at least once a year for everyone over 60. The consultation is quick, the basic exams are simple, and the result can be priceless. Don't postpone it. Schedule this week if you haven't done it yet. Your future self will thank you. Final word about community. We don't take care of our health alone. We take care with family, with friends, with our medical team, with our community. Talk about heart health with people you love. Encourage that friend to do the checkup. Walk together, share healthy recipes, reduce processed foods together. Health is built in community, and aging well is a collective achievement. God bless you. Until next time. Amen. Walk in peace. Eat with gratitude. Sleep well. Talk to your doctor. Laugh with loved ones. A good life is built this way. Peace and blessings. Amen.